I'm Dr. Siby Ayalloore. They call me Dr. Siby, and it's just easier that way. And so I deal with advanced heart failure. That's my specialty within the practice. Heart failure is a very growing disease actually in our time, because we as cardiologists have gotten better at taking care of heart attacks. And so now people don't die from heart attacks, but they're left with what's left over, and that's heart failure. So they're not dead, but they have this high morbid condition where they're suffering. And so that's one of the reasons why I like treating heart failure, because I'm really trying to alleviate someone's suffering. At the end of the day, we all die. Even Jesus died. But at the end of the day, we are all trying to really relieve someone's suffering when they come to our clinic. And so someone with heart failure has shortness of breath, has sometimes chest pain, has some swelling. They can't really get around their house without feeling really tired or short of breath, just even like going to the bathroom. So these are the kind of problems. If we can help them with this, then we can help their suffering. So a lot of people actually have heart failure and they don't know. So one of the things that we do to evaluate that is with echocardiogram, so we can actually see the heart function. However, I would say maybe about 30% of the patients don't even realize they have heart failure because they're young, or their body can kind of compensate for their problem. And so people with diabetes, hypertension, they can have heart failure develop from those processes and they won't even know. And so that's always a problem, to kind of capture them early so we can give them appropriate therapy. The number one cause of heart failure is ischemic heart disease or heart blockage causing damage. But there's this whole other 50% of people that have disease from long-standing diabetes, long-standing heart failure, long-standing kidney disease, long-standing hypertension. Sometimes people who are pregnant can actually get heart failure from that. Just like if people get diabetes from pregnancy, they can get heart failure from it. You have people that get infection. One of the things people worry about right now during COVID-19 is there going to be an increase in heart failure because of the inflammation and the damage that the heart takes? We don't know yet because it's such a new disease process. There's a lot of different ways to actually develop heart failure, and there's a lot of different treatment options, but we always have to find the right treatment for the right patient.